Pain, that medically elusive evil. What about changing the focus from controlling pain to understanding pain as more than a symptom? Can pain be cheated? My name is Dr. Dean, chiropractor and physiotherapist. My goal is to reframe how medicine understands pain to improve care. This podcast series is dedicated to a same-day conservative treatment for low back pain. This podcast has a companion published article, number 10. Welcome to the Pain is Not the Only Problem podcast. The essentiality of conservative care is being reevaluated. The contributors to patient symptoms are being re-explored. All options are on the table. Article number 10. Afferent Signal Loading Part 1. These articles intend to reevaluate the prevailing clinical practices thought to manage low back pain, to submit and debate novel low back pain contributors and mechanisms, meet patient expectations and satisfaction, and clinically meaningful results, recommend a conservative non-surgical course of care to override pain instantly, and restore ADLs and patient confidence on the first visit at low cost. Afferent Signal Loading, ASL, as described by Dean 2016, describes the prioritization of a set of sensory sense signals passing through the ascending peripheral nerves to the spinal cord to the brain for interpretation, aka listening. Afferent signal loading is important when interpreting low back pain signaling and, more importantly, techniques to hijack the low back pain signal to manage pain. The brain listens to how hard muscles are working, the amount of tension, if it's high, if it's low, on the muscle, how fast or slow the muscles are contracting, and the various positions of the joints. For example, if a person attempts to lift a bucket of something, whether it's water or mixed concrete or popcorn, without knowing the contents nor the weight, the person would likely prepare with some pre-tension in the arms, legs, and lower back before lifting the bucket. When the load is popcorn, the brain senses less weight and releases body tension and lets the elbow bend to raise the bucket. When the load is concrete, the brain senses unexpected extra weight, adds body tension, adds work to the arms and legs and lower back, but not to the elbow, since the brain senses that bending the elbow is not safe or possible and redirects the work back to the legs and the lower back. The brain is listening when a person performs work that involves the lower back and the rest of the body simultaneously, but it listens to these and other sense signals simultaneously. However, these sense signals are prioritized. The brain is listening to some sense signals before others. There are three factors to ASL, afferent signal loading. 1. The diameter or thickness of the nerve fiber associated with the sensory signal. 2. The number of motor units associated with the sensory signal. And 3. The muscle tension associated with the sensory signal. Let's break this down. Nerve diameter. Largest diameter equals greatest signal speed. Largest diameter loaded first. Motor units. Largest, we'll say aggregated. Contraction priority. Anaerobic units loaded first. So we say anaerobic are usually the stability muscles, anti-fatiguing muscles. And third, tension. The greatest tension equals the highest contraction priority. These muscles are loaded first. So let's break that down again. Nerve diameter, motor units, and tension. The greatest nerve diameter and the greatest number of motor units recruited and the greatest tension creates the greatest afferent priority. Afferent signal loading priority is sequenced according to diameter, units recruited, and tension, activating or firing whichever combination provides the most of all three. Then this becomes prioritized. Action equals muscle and joint sensing. Afferent signal loading priority, first priority. Joint position changes, action loading, so muscle loading, muscle work loading, plus action or muscle load speed, and natural gravity sensing. This is the first thing that the brain is listening to. Again, joint position changes, action loading, action speed, and natural gravity sensing. For example, first priority would be improved if this patient or your athlete was standing on their feet versus laying down on the floor. When they lay on the floor, there is little to no natural gravity sensing, and that becomes removed. Second priority, vibration sensing. Vibration occurs in the joint capsule and in the muscle belly. Vibration sensing can also be described as acceleration into deceleration, as in a jump. Landing in a jump creates whole body vibration. That is the second priority. This is the second most important thing that the brain listens to. Remember, this is based on nerve diameter, the greatest, motor units, the greatest, and the tension, the greatest. Perfect example is landing in a jump. Third priority, broad tactile contact plus pressure tactile content plus muscle tension sensing. Third priority example would be like a deep sports massage using the broad contact of the forearm or the knee, where displacement of the tendons and the muscle is experienced. Fourth priority, temperature sensing plus spicy sensing, which is evident in capsicum, plus vapocoolant sensing, which is evaporation. Fourth priority is paying attention to actual temperature, room temperature, body temperature, or temperature that's experienced at the skin as spicy or cool, as in vapocoolant, like spraying with biofreeze or icy hot. Fifth priority, fast pain, pinch, sharp, cutting, electric shock sensing, examples of high danger. Last priority, slow pain, dull, achy, burning, annoying, raw sensing, low danger. Review, afferent signal loading priority. First priority means the first thing the brain is paying attention to. These are the largest diameter nerves with the largest motor units with the most tension. First priority is muscle action. Second priority is vibration. Third priority, broad tactile contact. Fourth priority, temperature sensing. Fifth priority, fast, dangerous pain. Last priority, slow, achy pain. Low back motor use feedback is the sensing of muscle action and joint use. The brain listens to the demands of motor use when it receives afferent signals and makes cognitive choices about how to proceed with that muscle action and joint use. After mixing in emotional signals, memory signals, safety signals, and feasibility estimation. The nerve diameter that provides the brain with first priority senses are 100 times the diameter of the last priority sense, being slow pain, chronic pain fibers. This means that the slow pain fibers are 100 times less activated and 100 times less listened to than muscle movement. Third and fourth priority sense signals are listened to 3 to 10 times more than the last priority sense signal, which is why stretching, massage, hot and cold therapies are used for low back pain, simply because the brain is listening to those higher priority signals, not because stretching, massage, hot and cold therapies actually reduce pain. The therapies are only temporarily distracting the brain. Temporarily. Afferent signal loading describes the intrinsic prioritization of sense signaling. Motor units are the highest priority since they report the three-dimensional experience of the person. The most valuable information that brains should listen to is the feedback that sustains survival. Muscle work is required to perform the various actions of basic survival: sheltering, acquiring and preparing food, and self-defense. Contemporary lifestyles are made for convenience, yet the prioritization of afferent signaling remains useful in ADLs, sports, hobbies, and the like. Thank you for joining me today. Let's advocate for improved patient satisfaction and for the profession. Let's demonstrate a cross-cultural willingness to strengthen medicine. Thank you.